Welcome to Chillin' 101. We hope this video helps.
You begin immediately by confirming anesthetic is working and the patient is steady. This keeps measurements accurate. Once done, power the Tonopen and verify the calibration or self-test light is normal. Make sure a sterile cover is fitted and the tip is clean because contamination changes readings. Hold the device like a pen with a relaxed wrist and set averaging to 3-4 readings. Position yourself so the patient's eye is level with you. Then bring the Tonopen toward the cornea perpendicular and ready to touch briefly. You now focus on technique. Approach the central cornea slowly and make light contact perpendicular to the surface to avoid tangential error. Once the Tonopen beeps, hold steady for the displayed reading. Repeat this for a total of 3 to 4 valid measures. Make sure to keep the patient's gaze fixed on a distant target so the cornea is stable. After capturing values, inspect each for outliers. Once you have consistent numbers, compute the average in millimeters of mercury and record time, and eye side in the chart. You finish by removing the sterile cover and disposing of it appropriately, then disinfect the Tonopen tip according to facility protocol. Make a clear entry with the averaged IOP, which eye, and any patient movement or technique notes so follow-up comparisons are valid. If you encounter inconsistent or unexpectedly high or low readings, stop and reassess. Check perpendicular alignment, ask the patient to blink and rehydrate the tear film, confirm batteries and calibration, then repeat measurements before relying on the result.
Thanks for watching. Consider subscribing if we helped you.